Hi, my name is Juliane Trapse, and this is my scholarship entry for the 2014 Future Medical Leaders in the Field of Science Congressional Meeting. And the prompt was question authority, think big, address a problem that is found in society today that we can diagnose and or fix through the use of medicine. And so my topic was finding a better diagnostic test for ADHD. My inspiration for this comes from Mr. Dan Sullivan, the founder of The Strategic Coach. I found the inspiration when I was listening to him, and in the very beginning it was kind of a rocky start, and Mr. Sullivan himself joked about being a little bit off today because he forgot to take his pills. And so that kind of piqued my interest. And afterwards, after his stage performance, I sought after him and I found him sitting down talking to a bunch of other scholars. In talking with them, I asked him what pills was he talking about, and he said Adderall because he was diagnosed with ADHD. Then the sad part came, and the epiphany for me after this. He told me that 44% of the students in America that are diagnosed with ADHD, 44% of those people do not have ADHD. They undergo unnecessary treatment. The misdiagnosis of ADHD is the problem. No single test, just one, can be performed to find whether or not a person has ADHD. Instead, a series of tests and contacting a child pediatrician who may or may not diagnose the child or person, or a mental health specialist could be used to determine whether or not that child has ADHD. So what they do after they contact one or the other, those people go throughout a systematic way of trial and error, deciding whether or not the child itself has ADHD or possibly Tourette's or OOD or ODD. And so after a bunch of trial and error, this child themselves is put through a series of treatments, from hormone solubles that they're forced to take to amphetamines such as Ritalin or Adderall, or even just therapy, hours upon hours of therapy that the child itself does not need. ADHD is attention deficit hyperactivity disorder. It is a mental disorder found mostly within children, and the three subtypes are predominantly hyperactivity / impulsive. The second subtype is inattentiveness, and then the third subtype is the most common subtype of ADHD that is found within children. That is a mixture of both the hyperactivity, impulsiveness, and inattentiveness. The symptoms include not being able to focus well, inattentiveness, not being able to control their behavior, not being able to focus on one subject at a time, and not being able to work well with other students. As well as if a brain autopsy, which hopefully this isn't done ahead of time, has been found that there are parts in the brain that the brain tissue itself is weakened around the areas that include the function of attention, but throughout time, as the children grow older, those areas become thicker and of a normal thickness, thus allowing them to focus better but still exhibiting ADHD. Causes have been linked to genes such as a UK study that was focusing upon twins and whether or not they inherited the ability to have ADHD from their parents. And environmental factors such as cigarettes and alcohol consumption during pregnancy have been shown to correlate with higher risks and tendencies of the child having ADHD. Brain injuries of children are linked with symptoms of ADHD as well. However, only 2% of the children that have brain injuries actually have ADHD. And sugar, which actually has been discredited as of late with different experiments done, such as a study led where 20 children were divided into two groups. However, all of them were given NutraSweet, which is a substitute of sugar, and half of their parents were told that the children were given sugar, and the other half of the parents were told that the children were being given NutraSweet. And later, the parents had to diagnose or rate the children upon hyperactivity. The parents themselves that thought that their children were receiving sugar rated the children higher in hyperactivity than the parents themselves that thought that the children were not taking sugar. So this could tend to lead towards the misdiagnosis and why people assumed children that had sugar had ADHD, while it was not the case. And food additives have been shown, such as the different color dyes that we insert into our food or the chemicals, and are one of the theories upon what causes ADHD. Diagnosing upon the average age of 7 years old is when most children are diagnosed with ADHD, as children at the age of 7 are already into elementary school, and it is usually the teacher that knows or that notices an abnormality within children as they play on the playground or while they're in class. And it's usually the teacher that would suggest ADHD to the parents for the child themselves. 4.1% of American adults ages 18 and over are diagnosed with ADHD, as well as 9% of adolescents from 13 to 18, and boys are more likely than girls to be diagnosed with ADHD. However, in the recent 21st century, there has been an enormous jump with the diagnosing of students. It's been a jump over 30%, and it is unclear why. However, lead researcher Barkley himself attributed the jump to the lowering of the diagnostic standards of ADHD, making it more vague and allowable for other people to fit under having symptoms and the disorder itself. Thus, with more teachers reporting students not being able to focus well in class and or being a little bit inattentive, have been leading the children themselves towards the possibility of having ADHD and misdiagnosing the children. There has been a larger jump within diagnosing many people. Other possible disorders that could be attributed to the symptoms of ADHD is ODD, which is oppositional defiant disorder, conduct disorder, anxiety and depression, bipolar disorder, and Tourette's. The origin, however, though, after a May 14, 2014 study by the Strasbourg University, a Mr. Michael Reber was able to find that ADHD is a neurobiological disorder. That's the origin of it. And what is revolutionary about that is that now that it's been diagnosed there, that it begins there in the superior colliculus, which is found in the midbrain, as seen over here, it looks a little bit like a half almond. It is within sensory and motor functions, and it's a buildup of the neurotransmitter norepinephrine, which usually is targeted to the adrenal medullary glands, have been seen through the origin of why ADHD happens in certain people. The study itself, or the experiment itself, was done on a series of rats, where half of them were given a genetically modified superior colliculus, and the other half wasn't. Now, most of the previous treatments for ADHD that we know as of the 21st century have been targeting dopamine reactors, or dopamine itself being transmitted and or conceived. And so now that we know that it is actually the superior colliculus and not dopamine but norepinephrine, I have thought of a different way to diagnose, and this is my option towards treatment. The solution itself is that we do hormone testing for norepinephrine by taking a blood test of catecholamines, which are usually found within high blood pressure patients. And of the catecholamines, we focus and target norepinephrine. I suggest that we do that in a procedure such as we first look at the children of people who previously were diagnosed with ADHD and of people that believe themselves to have ADHD. We will bring them in to draw blood. Then we will send it to the labs where they will track first the catecholamines, and then they're going to look specifically at the levels of norepinephrine. Now, after we do that, they're going to monitor the levels for at least 6 months to make sure that the levels of the patients are consistently high and it's not just a random fluke of the patient having a bad high blood pressure in one day, rather than actually having a higher level of norepinephrine being normal to them but not to the population or society itself. After the blood test is performed, a holistic review of the patient with the normal procedures that we've been doing so far, such as the trial and error of cutting out the possible symptoms the child has, and being able to make sure that we're not misdiagnosing it for the others, will be done, so that it'll be more of a double check at safety. And then if the patient actually does, the results come back positive on having a higher level of norepinephrine, the patients itself, if they are sure that they want to continue with the treatment, will then be treated with either specific diets, which have been shown in the UK studies, of specifically lamb, rice, potato, vegetables, for about 9 days, and then for those 3 days have Ritalin, and then amphetamines such as Ritalin and or Adderall. Those sort of things will be given as the treatment if the child actually does have ADHD. And treatment such as the specific diet and the amphetamines then will be implemented. If we can do that and diagnose children at the earlier age rather than 7, and if we can properly diagnose them, we could revolutionize the school system in allowing children that are diagnosed with ADHD, that 44%, to have a brighter future of being able to be cured of it itself, and of being able to have been diagnosed earlier and properly, so that they would have the ability to function later on in society as a functional and well-working societal member. And that would be my presentation on how we could have a better diagnostic test for ADHD. Thank you for your time.